Hey, you guys, Tanner here, coming to you with a simple question. When's the last time you prescribed a thoracic mobility program? Probably not super common. Maybe you don't remember. Maybe you never have. But why is that? This segment appears to be highly overlooked, sort of lost in between shoulder and hip mobility and strength that we often focus on and have a lot more tools in our arsenal when it comes to treating, evaluating, and looking at these areas. And while both of these are critical, thoracic spine mobility, for throwers particularly, is incredibly important in creating shoulder and hip separation that is required and seen in high velocity throwing sports. So in an article by Bullock et al., thoracic mobility can be thought of as a linchpin in the transfer of force between lower extremity and upper extremity, especially in the context of a fixed or planted lower extremity. And so lack of thoracic mobility may play a role in modulating shoulder and elbow pain and stress in throwers and rotational athletes. But I do want to emphasize that while thoracic spine mobility is very important for your rotational and throwing athlete, it also has implications and effects on your everyday person who's working or just performing their activities of daily living. Because when you think of the spine as a whole segment, you'll understand that limitations in one area can also have effects on the segments above and or below it. And oftentimes, this can manifest in pain and stiffness, particularly in the low back and even, again, the neck. So even if you have someone coming to you who is a non-thrower or, again, rotational athlete such as a golfer, maybe even a volleyball player, and they have something such as low back pain or maybe even neck pain, the T-spine is something to look at because it can certainly have more of an effect than you may think on these areas. If these type of athletes do not have the mobility or lose it over the course of a season, they will continue to try to perform at the same level that is required or that they were performing at. What ends up happening is compensatory loads can be placed on the shoulder and the elbow, even the low back, while they're attempting to increase or just to simply maintain the rotational velocity that they either had or that they need. And so given all this information, the million-dollar question becomes, how do we assess for and how do we increase or implement a program to increase thoracic mobility? So T-spine extension and rotation are typically limited due to tight musculature in opposition to weak and or underactive musculature or compensations from the lumbar spine. And so I'll be demonstrating how to assess for thoracic spine rotation and extension to give you an idea if you need to prescribe a T-spine mobility program. And then we'll be going into from there 4 exercises, 2 that are designed to help increase thoracic extension and 2 that are designed to increase thoracic rotation based off of your findings. So starting things off, we're going to assess rotation of the thoracic spine in a lumbar locked quadruped position, as you see me in here. And this is to eliminate the low back's influence on overall rotation. So we're setting up, one hand behind the head, the elbows out, and when the clinician says go, the athlete or patient is going to rotate the elbow towards the ceiling. And for purposes of quick eval, if you have an inclinometer, you're awesome. That's the best way to do it. But if you're able to eyeball from the starting position with the elbow straight out up to maximal point of rotation towards the ceiling, that will give you a pretty good idea of their thoracic spine mobility. And so as we see here, the mean range of motion is anywhere from 40.8 degrees with a pretty big standard deviation of nearly 11. So, anywhere from 35 to 40 is kind of what we're looking for to start off with, as what you would consider to be a normal range. And so things outside of that are going to pique your attention as to maybe being a good reason to prescribe a thoracic mobility program. Moving into assessing for thoracic extension, I've chosen to do so dynamically. You can also do it in a supine position, but I like this example because you get to see two ways which a patient might compensate if they have a tight T-spine. And so firstly, you'll see me squatting in almost like a forward trunk lean position, almost bowing forward. So a tight T-spine can prevent the ability to fully flex the shoulders and bring the chest upright if you don't have the right amount of thoracic extension. It can also indicate tight lats, and oftentimes those two can go together. And secondly, if you see the patient achieving a more upright posture, flexing the shoulders overhead like you would want, you'll see the compensation of an increased lumbar lordosis as an attempt to kind of go around the T-spine and just use the lumbar spine as a way to stand up straight and also reach the bottom of the squat without having to bend forward. So now that we've assessed for thoracic rotation and extension limitations, we're going to move into the exercises. The first two are aimed at helping to increase thoracic rotation. As you see me here, I'm performing a side-lying open book exercise to help with thoracic rotation. We're going to set up as I am in a side-lying position with a foam roll, or you could use a towel under a flexed hip and knee. And what this does is help keep the lumbar spine stabilized and neutral. You'll cue the patient to place their hands in front of their eyes before opening the top arm across their body to the opposite side. You'll cue them to follow their arm with their eyes so they're getting a good twist of the T-spine. Have them perform 8 to 10 reps each side. Moving on to our next rotation exercise. This is a thread the needle exercise. So we're going to set up in a quadruped position. We're going to cue the patient to take one arm and quote-unquote thread it through the gap between their thigh and the opposite arm. They will rotate until they reach an end point and then retract the arm all the way out past the starting point, rotating the hand up towards the ceiling. After reaching that end point, they're going to return back to the start position, and they're going to perform this 8 to 10 repetitions for each side. Okay, now we have our first of two thoracic extension exercises, and this is a simple thoracic extension performed on a foam roll. So we're setting up with a foam roller on the ground or a table as you see me, and the patient will lie on their back onto the foam roll so that it's just below the shoulder blades. Have them place both feet on the floor and keep neutral hips and low back. They'll place arms overhead and gently lean back until there is a stretch/end point. They'll hold it for 1 to 2 seconds before returning to the top of the exercise and again perform about 8 to 10 of these. So to wrap things up here, our last exercise is a kneeling cow with a workout bench or low table. So set up in front of a weight bench or low table with elbows resting on the bench about shoulder width apart. Fingers can be either interlaced behind the head or holding something like a PVC pipe. You'll see me using a half foam roll. That works as well. And so we're going to simultaneously flex the elbows while gently sitting back over the hips to attain thoracic extension. You can also cue a little bit more thoracic extension by having the patient focus on looking up while in the bottom of the exercise, so at the point of maximum thoracic extension. At the bottom, they can hold the exercise for 3 to 5 seconds and perform this 8 to 10 times. Thank you so much for watching this video, and hopefully you got a few ideas on how to assess and also intervene on the thoracic spine in the event that you feel like your patient or athlete may benefit from it. Thanks again.